First on News 8 at 11 tonight, prescription drug and opioid abuse is a deadly problem that's worsening here in Michigan and across the country. Now, a state task force assembled to take on the issue has taken its first step toward battling it, releasing their list of recommendations today.
New tonight, 24 News 8's Evan Dean talked with a local doctor on that task force. He's joining us now live in studio. Evan.
Yeah, Brian and Marley, this report outlines more than 24 recommendations to combat the growing problem of prescription drug abuse. But one local doctor says the most important one of all is the push to improve access to naloxone, a drug that can reverse the effects of an overdose and ultimately save lives. The numbers outline the growing problem. Michigan ranking 10th nationally in per capita prescription rates of opioid pain relievers, 18th in overdose deaths. And that painkiller abuse often leads to heroin use. Our state's heroin-related overdose deaths per 100,000 people have doubled over the past 5 years.
The number one preventative killer of people in our state is opioid overdose.
Dr. Corey Waller specializes in integrative medicine at Spectrum Health, and he's one of the task force members pushing to make this drug available over the counter. Naloxone, or Narcan, reverses an opioid overdose, whether it's from heroin or another painkiller.
What we had to get past was this misunderstanding that making this drug available, it does not change the more people that will use. It doesn't change, the way in which they use.
The RED Project in Grand Rapids works to reduce the risk of HIV, and they often deal with substance abuse. Today, their executive director showed us 3 variations of naloxone rescue kits.
3, 2, 1. Injection complete.
They've been distributing these since 2008.
What that's resulted in is over 260 times somebody who we had trained and issued a kit to, reporting back to us that they were able to successfully use one of these kits to reverse an overdose and potentially save somebody's life.
Now, a bill that passed the State House would provide protection for minors who call 911 if a friend or family member is overdosing. Dr. Waller said another important aspect of this report is the push to expand those so-called Good Samaritan laws and limit criminal penalties for people of all ages in those situations. We do have a link to that full report on our website, but it's important to keep in mind that for now, these are just recommendations. Many of them would require changes in legislation, changes in licensing, but it has yet to be seen if they'll be implemented or not.
Yeah, there's a learning curve here because folks need to get educated about what these drugs are doing, what they're not doing, right, and how effective they can be.
Yeah, and in fact, one of the recommendations is to create a public awareness campaign and essentially try to get rid of the stigma associated with this kind of drug abuse, allow people to talk about it, address it, say it is a problem, and there are ways we can treat that, and then get to those treatment options.
Mm-hmm. That's right. People to realize that this can happen in your neighborhood, in your child's school. So.
Yeah, and there are ways it can be treated, and hopefully this will help outline those problems.
Yeah.
Thank you, Evan.